morning, good afternoon, and good evening, everyone. Thank you so much for joining this very important discussion about mental health stigma in the workplace and what employers, employees, and people with lived experience are doing to improve mental health in the workplace, and through that, addressing mental health stigma. I think we've all seen through the recent pandemic just how important mental health problems are to so many of our communities and workplaces, and now more than ever we need to take action to improve the mental health and well-being of our workforces. Welcome to MindForward Alliance's Global Summit, and I'm delighted to have a wonderful panel to hear from and learn from all across the globe today, and we'll be introducing our four amazing panelists in a minute. This important discussion is being led by the Global Business Collaboration for Better Workplace Mental Health, as I'm sure you're aware, on addressing stigma within businesses. And by businesses, we mean employers of all sizes and shapes. The collaboration is a global business-led initiative committed to advocating for and accelerating, I love that word, accelerating positive change for mental health in the workplace. We'll get a chance to hear a little bit more about some of the work of some of the members of the MindForward Alliance and the GBC in the panel today. The vision of the GBC and MindForward Alliance is to create a world where all workplace leaders recognise signs of struggle, have the right tools to support employees and commit to take tangible and evidence-based action. It's really vital that this is evidence-based action. To create better workplaces for mental health and well-being, enabling our workforces to thrive. I'm Sue Baker. I've worked to destigmatise mental health in England and across the world. I've had the privilege to work with some amazing partners, one of whom you're going to hear from today, but also to share lived experiences in the most evidence-based way we have to address mental health stigma. And that's those of us with lived experience, sharing that in a meaningful, effective way. And I hope that by doing that, we're following the most evidence-based practice in addressing stigma, which the Lancet Commission report recently reinforced, is the most evidence-based way across our globe, across our contexts, across our cultures, is to effectively share in a meaningful way the lived experience that so many of us have. And we'll come on to that a little bit later, hopefully. Without further ado, I just want to say, introduce the panel. There's a lot more I could say about stigma and the negative effects, but you're actually going to hear about that from the panel. I think just before we start, one alarming statistic to bear in mind is that still there are so many people around the world who feel unable and unsafe to disclose their mental health problems, either to seek help or to help address stigma. And just a couple of stats from Deloitte's Mental Health and Millennials research in 2021 highlighted that 33% of millennials said they would not feel comfortable speaking to their manager about feeling stressed, anxious, or any other mental health challenges. And 44% of millennials and 38% of Gen Zs who did take time off the work because of stress or anxiety said that they hadn't disclosed the real reason to their managers because talking about mental health at work is still stigmatized. So whilst we're going to hear about some fantastic practice, the key message here is there's still a huge amount of employees and managers that don't feel confident or equipped or safe to talk about mental health and to seek help. So that's what we're going to hear from today, is some inspiring examples of where action is happening. Let me please introduce you to our panel. First up, we have Jasmine Hong, who is CAIA, Head of Pensions and Retirement at Hong Kong HSBC. Thank you for joining us today, Jasmine. And then we have Charles Alberts, who's Global Head of Wellbeing and People Experience at Clifford Chance. So Charles has a global role looking at workplace mental health and wellbeing. And then we have Dr. Edwin Ho, who's VP Health and Wellbeing for Asia in BP, who's a regional leader with a focus on Singapore and Malaysia as well. So we're going to hear from Edwin, who also has a background as a physician as well. And then somebody I've had the total pleasure of working with for the last 4 years, Rosemary Gathara, who is Chief Exec of Basic Needs, Basic Rights Kenya, a mental health NGO working to destigmatize mental health and many other things in Kenya in East Africa. So welcome, and we're going to start with a series of questions for our panel, but please do post questions in the chat, because we've got about 10 minutes at the end of the panel for questions for you to ask any of the panel. So please do think and submit your questions as hopefully the conversation and thoughts are provoked by what some of our panelists are going to say. So Jasmine, if we could talk to you first, if that's okay. Could I just ask you a quick question? I'm afraid we only have 7 minutes per panelist, so we're going to have to be here for hours, but we're going to have to keep it quite short. But you are very passionate, as I've heard and many have heard from you, about addressing mental health stigma as a global mental health ambassador at HSBC, who's been doing a lot of work on mental health around the world. But could you tell us why this topic of addressing stigma is so important to you personally and professionally?
Sure, thanks, Sue. First of all, I would like to really thank MindForward Alliance for putting this together, because I think amongst all the panelists, if I may say something, is that we're all here because we do care, right? So this is the very first thing. And in terms of why I'm so passionate about mental health awareness, I actually had some personal experience. Actually, it was just not long ago, it was last year, when I actually lost my father. It was a very, very painful experience for myself. I'm also a working mother with 2 young children. And work-wise, I think, I did take some time off when my father passed away, but I think that level of stress and that level of, I would say, pressure is something which is unprecedented for myself. And for me, I was very grateful for my husband, who was super supportive, and he also thought that I wasn't well. He said you should seek some help, right? Because he hasn't been through something like that, and he wanted me to actually really look after myself. And I remember that very day, I also got a message from my manager. He actually suggests, HSBC has the resource that might help you, right? It's up to you, right? Something called our employee assistance program, where there's a number you can call and book an appointment and see how it goes. And I was having some time off at that time anyway, so I thought, well, why don't I just call, right? It's an hour and see how it can help me. And turns out it was something that I would really recommend to other colleagues of mine who are going through similar situation, difficult situations, right? Because in life we have so many things to struggle with. And it is very, very lucky of myself that my company is actually having those tools and resources available for us to leverage on. I must say that as of now, I still feel painful when I think about my father, who I think he lives in my heart, and I forever miss him. But whenever I see people who are dealing with difficult situation, I'm always there to talk to them, and I would like to really raise the awareness of taking care of yourself and how to leverage on company resources to actually help one's situation.
Jasmine, thank you so much, and I'm so sorry. I'm sure so many people on this session send you their heartfelt condolences. It's such a heavy loss, isn't it? And we send our love and support to you. Thank you for being so open. Could I ask you another quite personal question, which is, so you are an ambassador, aren't you, within HSBC? So your role as an ambassador is to help reduce stigma by sharing your lived experience, your own experiences of mental health issues. And we know, as I mentioned earlier, that the Lancet Commission, which looked at 20 years of academic research on how to effectively address stigma across all of our contexts globally, said that the most effective way is through having contact with somebody, disclosing in a meaningful way. Now, you've been doing that at HSBC. I wonder if you could tell us a little bit more about your role as an ambassador, a mental health ambassador at HSBC, and the kind of reactions you've been getting from people and the impact that you've seen of being so open.
Sure. So I think as an ambassador, right, it seems like a very big role, but I think, you know, we all have a part to play in terms of really taking care of our mental health. So I think one example is it's a global program for us where we have ambassadors across the world, and we actually organized webinars a few weeks ago for our employees, and it's a regular session where we actually would feel like, you know, there are certain topics we would talk about during this type of webinars. And one thing that I shared in my last sharing was, I talked about empathy, where I feel, you know, it's not because I'm an ambassador, that's why I go around and talk to people, right? But I think, you know, if everyone actually try to take part of it, everyone try to actually take care of themselves and the well-being of others, it's a collaborative effort where I think by spreading that word is actually much more powerful than having me doing this as just one ambassador, because it really takes the whole group and whole team effort to really bring the awareness. And I think talking about stigma, right, in my culture, I think it's also something that people will try to avoid talking about. Say, for example, people might think that mental health or illness it could be a permanent condition, right? It could be, right? But for me, I think that I had mental health challenges for a period of time where I struggled to really look at anyone to talk for like 5 weeks without tears in my eyes, right? So it's a very short-term kind of scenario for myself, but I think for people who may not be aware of it, they cannot take care of themselves, it can become something more permanent and persistent. So I think by talking about it more, by actually making people aware of what they can do or who they can leverage on really to fix that situation for them, is very important, because by, you know, shying away from it, which is my culture, that's the way of dealing with it. But I think that nowadays we just really need to be open, and we need to really bring the awareness back to everyone.
Jasmine, thank you very much. I'm sure many people on the dialed in are going to think, I wish I had a Jasmine in my organisation. But that's the idea, isn't it? Is to grow the talent, to make it safe for people to become ambassadors and to share their lived experience. As you say, often with a team of other people, because rather than have just one person identified, it's better to do it in a group where you've got peer support. So thank you so much. Welcome. If we get a chance to come back to you in some of the responses to questions, I hope we could really hear more. Jasmine, thank you for being such an inspiration. Charles, now I'm going to come to you, and you're wearing your green badge. Brilliant. 10 out of 10 for your branding campaign. So Charles, you have a global role as head of wellbeing and people experience, don't you, at Clifford Chance? So what kind of strategies do what kind of strategies have you adopted to address mental health stigma amongst employees in different parts of the world? I wonder if you could share a little bit about your sort of main approach, but also where there are different approaches adapted.
Absolutely, yeah, with pleasure, Sue. And I just quickly want to say hello everyone. Great to be here, and also thank you from me to the MindForward Alliance for putting on this session. But I think for me, firstly, it's important just to recognise, you know, none of us have got all of the answers, right? If we did, and there was a template to follow, then life would be a lot easier. But I think it really takes, you know, commitment and vision for businesses to really have an impact, and a positive impact, on people's mental health and well-being. And that's where I think we start. And that's one of the reasons I am a big supporter of the global business collaboration. There are, you know, 6 pledges that we make as leaders, really sensible things that we can do. And if we really commit to those on a global basis, we can make a big difference. And it starts with having an action plan, and it kind of ends with the measurement. So let's look at what the key things are we're trying to drive in our businesses, and let's see whether we're successful with them or not. And if we're not, what do we need to adjust to do it better? I think from a global perspective, that kind of vision and commitment, and even creating a framework for how we do this, can be really impactful. but we need to implement our activities at a local level. Our cultures differ, our attitudes differ, the context in which we operate, we live, we work differs in different countries. And I think when we do that, then we can have a maximum impact and reach as well. And those are two things that are always important to me. I think in anything that we do, how do we reach the maximum number of people, but also how do we have genuine impact on them? And to give you one example of that, I'm in India at the moment, visiting our offices here, connecting with our colleagues, creating that safe space where people can be honest with me about, what their views are from a mental health and well-being perspective, where the opportunities are, where the pinch points. And I'm already learning, so much that will really help me focus our strategy for this region. So things like understanding how important hierarchy is in businesses in India, how important family are, and the support that your family provides you as part of your network, but also the stigma and the shame that still exists in society broadly. I think we need to be really sensitive to those kind of factors. So I think, sorry, go on.
No, you carry on, Charles.
No, I was just going to say, so I kind of think, I look at this as at three levels. So firstly, as a firm, we have the commitment, vision, we want to create the right culture for our people on a global basis. But then I think we take it down to a team level, the importance that managers play, making sure that they understand what their role is in supporting people, but also equipping them with the knowledge and the tools and the confidence in order to support that. But of course, we go down to individual level as well, because we all jointly are part of the solution.
I love that. Thank you, Charles. Sorry to interrupt. Yeah, absolutely. So it's at all levels of an organisation that there needs to be leadership and support for a mental health sort of initiative. And on that point about leadership, what kind of role can global and regional leaders play in destigmatizing or addressing stereotypes and myths and discrimination around mental health? So what's the role for regional and global leaders in this agenda?
I mean, I think around the world, kind of no matter where you're based, leaders are so important in setting the tone for the organization. They set the stage, they give people permission to talk about the things that are really important to them. I think creating a safe space that I referenced earlier on is just absolutely vital for people to be honest and proactive and putting their hands up and getting the support that they need. If we don't do that, then we won't create an environment where people get the support that they need, and the consequences of that is negative for everyone, for the individual, for our businesses, and of course for society more broadly as well. I think increasingly and for all of the bad things that COVID has represented to us in the world, it's been an enabler for so many things. And I think it has really shone a light on mental health and well-being, but also the important roles that line managers and leaders in businesses play. Increasingly, we're asking our leaders to be open about these topics, to speak honestly about it, to be authentic. And I think that authenticity is really important for us to connect with our people. Otherwise, to say it as it is, I think people see right through it. They don't really believe the message. So we as businesses have a real responsibility to bring our leaders along on the journey with us as well, so that they can have a positive impact on their teams.
Brilliant. So well said. Absolutely. It's about, there's a hint in the title, isn't there? Leadership on the issue, and creating safe spaces by ideally being open to talk about mental health and well-being yourself and make it safe for others. Thank you so much, Charles. And as you say, everyone has a role to play in this area. That's fantastic. Thank you for your sage and wise advice, Charles. That's fantastic. Now we're going to move to Edwin Ho. Edwin, thank you so much for joining us today. I've got a couple of questions for you, Edwin. So we've heard from Charles about the importance of having a global vision and a strategy that's adopted by an organisation, but is localised to different contexts, because it's all about context, isn't it, as well as having some strategic leadership. As Vice President of Health and Wellbeing for Asia at BP, I know you have a focus particularly on Singapore and Malaysia. How has BP taken the topic of mental health into the region? What have you been doing in Malaysia and Singapore in particular to destigmatize mental health at BP?
Yeah, thanks, Sue, and of course thanks to the MindForward Alliance for setting this up. It's really exciting to be here and to speak with like-minded people. Just listening to Jasmine was very heartwarming. Charles, when I listened to him, it almost sounded like everything I prepared for today was just presented by him. So I'm really not sure what I need to present today. But I'll try my best to add a few things here and there because I think there are some differences that's still apparent. Maybe if I take a step back and look at mental health as a whole for BP as an organization, I would definitely say that we're very much aligned with what Charles said, in the sense that we have a program, we have a strategy, a direction, an objective that we want to achieve. And behind this big objective is really that leadership that drives it. Coming into BP, you would definitely hear the chief executive himself speak about mental health. It's amazing to see that in his town halls, when he addresses people, whether it was during the pandemic, even after the pandemic, in today's world where there's so much change, mental health is such an important topic, and he's brought it up even in his town hall. So I think it's really brilliant to hear, but not just him, the level of executives across BP, really senior executives talk about mental health all the time, and it's not just small talks. There are really talks with. Which goes out to the broader audience out there, and people within the teams also feel that they can and they're allowed to speak about their mental health, because leaders at all levels are speaking about mental health. So I think that's something which is quite similar to what Charles mentioned, but it's very real and apparent here in BP. And I think that's an important fundamental in any mental health programs, that is not just a theoretical program that we wish or we want to roll out, but it's a program that the leaders buy into, the leaders believe in it, right? And they themselves want to see their people getting better and being at their best. The other thing that I just wanted to highlight as well is that we have a health team within BP, and not many organizations have a health team. So we're very fortunate to have a health team. But then again, this health team does not tackle mental health alone, and it should never tackle mental health alone, because mental health is owned by everyone, right? So there's the ownership by the businesses, by the lines, by even individuals, that you own your own mental health. I mean, if today I were to fall and break my leg, I'm not going to depend on my line manager to make sure that my leg gets better, right? It's definitely going to be me taking care of my recovery, making sure I eat the right food, going for physio and doing the right checks and taking the right medication to get better. And I think similarly to mental health, we've started to make people realize that this is not something that the health team needs, only the health team needs to get you going. Leaders start to step up, and people within the organization. We're talking about middle management. We're talking about partners and collaborators within the business that says, hey, this is an interesting subject, for example. So we form partnership with people, and we start to say, let's work together to tackle mental health in your respective region. So if I look at it holistically, we really build ambassadors similar to Jasmine in HSBC. We have quite a few ambassadors when it comes to mental health. And again, these ambassadors are not really handpicked or anything. They really just come up and say, you know what, I've got this huge passion in mental health, and most of them would have their own personal experience with it. Yeah. There are also partner groups that I mentioned, the business resource group, for example, recreational clubs, social clubs, and things like that. Clubs and different parts of the partners that say, hey, you know what, we really want to do something about mental health because it affects us. We really like it. So that's another way that we reach out to people through ambassadors, through partners. And there's one other thing that we use, which is quite an interesting methodology that we use. It's a little bit technical. We did partner with the university to develop this tool, but basically it's an assessment tool. With surveys and people coming in to sit down and really discuss things, and to really put that thermometer into the organization to see what's happening in that in that particular business or function. And what we've seen is that the response is pretty impressive. People really like that the business is caring about them, how they feel, and it's taken them to the next level, because the interventions that come in work hand in hand in building mental health and resilience amongst these people. So that's really something that I wanted to highlight. And not forgetting the last point on the EAP, I think most organizations would have it. It's quite a popular thing in this day. We really need that support for people to be able to reach out to professionals when needed now. So that's a little bit about our strategy, Sue, in a nutshell.
Thank you so much for being generous enough to share that, Edwin. Really appreciate that. Very comprehensive response. So just very briefly, you've got a particular focus in your role in working to destigmatize mental health in Singapore and in Malaysia as well. I wonder, could you tell us, what are the specific challenges or opportunities of addressing stigma within a range of different cultures in Singapore and across Malaysia as well? How have you been going about that at BP?
So I guess just to clarify, the role is not limited to Malaysia, Singapore, but because I'm very close, being born out of Malaysia and work in Singapore currently, these are the two countries where I really understand what's happening there when we talk about culture and the Asian stigma. The other thing about Malaysia and Singapore as well is because we're a multicultural nation. We've got people from, we've got Chinese descendants, we've got people from the Indian descendants, and all kinds of people gather in these two countries, quite a fair bit. So we do see quite a lot of cultures here, which is really interesting. I would say that one of the big differences, and I'm not saying that this is exclusive to Asia, but to many Asians, the family upbringing is one big issue when it comes to stigma. I think Asian families, really don't talk about mental health at all. In fact, what we talk about is, just very superficial surface things, and speaking about mental health is something which is not heard of. Habits as well, we develop habits, and when we go around speaking to our colleagues and our friends, we don't talk about these kind of things, and as things go by, these are habits that we build up, and we just put walls around ourselves. And let's not forget that many parts of Asia, English is not our first language. So sometimes when we're spoken to in English, the mind thinks in our local language, and by the time it processes and tries to come out in the English language, it's difficult. So people actually have a little bit of that language barrier as well when they speak up. And then you have the male and female thing, and in Asia it's a big stigma as well, because men, always highly regarded as the person who's going to take care of everything, and it's not possible for a man to go down with mental health condition, because that's not right. He's not a real man if he has mental health issues, for example. My point here is that the stigma, that there's many other factors, and I can't go through all of them, but these factors and the stigma, they're really real, and it's important that we start addressing. I think things like this that we're speaking about this now is a great start. It's a great foot in to start talking about mental health, and people are realizing that they can talk about mental health with the leaders speaking about this, with their colleagues speaking about it, with some families speaking about this. It encourages people to realize that they can seek out support, because one of the most important thing about speaking about mental health is really getting that support. I can share with you about a very close friend, and I'm just going to take an extra minute for this, Sue. We grew a career together in the hospital. He was a really close friend, and then we parted ways sometime about 3 or 4 years ago, because he went into a different pathway, into a different medical specialty, and I came out into occupational health. But a few years ago, he actually committed suicide. And what was really sad about this situation was that no one actually knew at that time, but retrospectively, when we met for his funeral, when common friends and colleagues gathered together, the signs were clear, the signs were obvious. He was shying away from people, he was losing tons of weight, he wasn't even speaking up, he would see his patients and then hide to the corner. I mean, things were very obvious retrospectively, but I believe it was strongly the stigma. And even the doctors that we spoke among ourselves says, well, I thought, we should be able to take care of ourselves. I mean, at the end of the day, we're doctors. And even that stigma amongst the others who look at him as a doctor and say, he can't have committed suicide. I mean, he can't have mental health conditions because he's a doctor. He should know how to take care. He's taking care of us. He should take care of himself. And these are the corridor conversations that goes on. And I believe that, no matter how great a person is, the challenge that we all face as humans, we are still humans at the end of the day. And I think it's just so important that, we speak up to be able to seek help and support. Yeah, I just wanted to share with a little story at the end.
Thank you, Edwin, and thank you for sharing that. I'm very sorry for your loss and for everybody's loss. But yes, there is stigma everywhere, isn't there, in all kinds of professions. I find some of the worst stigma is actually within the health and mental health professionals, where the dial isn't shifting as much. So, I mean, that's tragic. I'm so sorry to hear that. But you're also right that there's also stigma in communities, in families, and this all interplays with what happens with stigma at work, doesn't it? You don't just have stigma at work, it's in communities, it's in all walks of life. Thank you very much for sharing that, Edwin. And Rosemary, moving on to you, thank you so much for joining us from Nairobi. It's brilliant to have you on the panel. Thank you very much, Rosemary. You've done a lot of work on challenging mental health stigma in Kenya. Particularly, I think you now have over 61 champions with lived experience who are trained and supported, and I highlight that, to share their stories safely and effectively. What does stigma look like, mental health stigma in Kenya? And how has working with those champions with lived experience help address that? I wonder if you could just share a bit of a general update on your stigma work in Kenya.
Thank you, Sue, and the MindForward Alliance for putting this together, and greetings to everybody joining in. So yes, Sue, we, as Basic Needs Kenya, we have an active ongoing mental health stigma campaign. Basic Needs has been intervening in community mental health since 2005, and we have found that one of the biggest barriers to recovery and for living and working well with a mental health condition is a stigma around mental health conditions. There are a lot of moral judgments, a lot of blaming and shaming. When somebody, as Edwin put it so well, people are blamed for the how could you, what do you have to be so stressed about, why, I mean, man up, and such statements come up over and over again. Culturally, of course, there's what did you do wrong? Is it a curse? Are you being punished for something that you did wrong? So there's not as much support for somebody having a mental health condition as there would be for somebody who is physically ill. So Kenya is one of 5 countries where we had the global Time to Change program, where we adapted the methods used in Time to Change England, and so happy to have worked with you on this and to continue working with you on this, where we had an evidence-based method to challenge the stigma around mental health, where people with lived experience were trained and they're supported to share their story with the public, so people can see beyond their diagnosis. So we have some of our champions. You have like Edwin, who'll share. He's an accountant and a very good one at that. He's a father, he's a husband, he's managing his life well, and he shares his mental health diagnosis. So he'll disclose he has his ADHD, he has depression, but he's working and he's very productive at his workplace because he gets the supports that he needs for him to be productive. So we have quite a lot of champions. They share what stigma has meant to them. We have people who've lost out on relationships, somebody ending a relationship because of their diagnosis. We have people who've been shunned by their family. Their family are not comfortable inviting them to a family occasion because they have a mental health diagnosis. But a lot of the stigma also happens in the workplace, where somebody makes a mistake and it's because they have this diagnosis. Other people make mistakes at work, but for them, they get a lot of stigma because they have their diagnosis. So people do not feel safe to share. And in fact, in Kenya, it's not covered by health insurance. So it means you're going out of pocket to cater for your own costs. So people mask it with other things. So they'll say they're going to the doctor for something else, but of course they're getting treatment for their mental condition. And it's unfortunate that this all contributes to a lot more people getting into crisis. We have a lot more suicides, a lot of severe mental health cases, because there isn't early interventions and there isn't a safe space for somebody to disclose when they have a mental health condition. So we're really proud of the brave champions who disclose their condition meaningfully, of course, and they help other people change their perception on mental health.
Thank you so much, Rosemary. And it's been a total one of the best parts of my life to have been in Nairobi with you and met the first champions who are changing the narrative in Kenya. So amazingly, with the right support to make it safe, because there are always risks to disclosing your lived experience, and those need to be well judged. And your team are fantastic at providing that support. And it's the peer support as well, isn't it? Between ambassadors or champions. It's really important that people don't do this alone, that we have others around us. So on that note, Rosemary, so that there's a lot of momentum happening in Kenya around mental health and wellbeing, isn't there? And we'd love to hear more about that. But so with this momentum on mental health, particularly in Kenya, and your work with champions, what do you think is the opportunity for improving workplace mental health and wellbeing? Is this a good time? Are the right things in place? And how do you think that might take shape in the coming years? If you could give us a bit of a picture of the current situation, that would be really helpful. Thank you.
Yeah, you're right. So a lot of momentum, a lot of good things happening around mental health in Kenya. We've just had a new mental health law. Our previous law was about institutions. How do you get people into psychiatric hospitals, and how do you keep them there? Or under what conditions can you let them out? Usually under presidential pardon or something like that for somebody who's did a crime and was in a mental health hospital. So that has changed, and there's a focus on community mental health. We've had Kenya Mental Health Action Plan, a very good plan on not just on treating mental health conditions, but on preventing and promoting good mental health. And I'd like to speak most about the investment case on mental health. In June of this year, we had the mental health investment case for Kenya launched. And it highlighted what the burden of mental health conditions is. And I'd like to say one of the things he pointed out, that we're losing 62.2 billion shillings per year to mental health conditions. And interestingly, only 10% of it, less than 10%, 5.5 billion is direct cost due to healthcare condition expenditure, but 56.6 billion, that's over 90%, is a loss due to loss of workforce and reduced productivity. So we're losing so much money because people are not getting the support for their mental health conditions. They're either absent or there's a lot of presenteeism. Somebody is present at work but not productive. We have, of course, the very sad losses due to suicide. We have the admissions to healthcare, or people just being unwell and not being able to go to work because they're unwell and not getting the care for their mental health. So it's a huge loss, and a huge loss to human life, quality of life. And that document really documents what it means for not just in terms of shillings, but even to the cost to people's quality of life and the cost to their life. And I mean, when we have so much loss of life. So this is the time. The government has recognized it as a priority. The government is putting in place measures to promote good mental health, but it's not just a health. It's not something you can wait for the Ministry of Health alone to do. Employers need to step up. They need to create supportive environments for their workforce. And I like what Jasmine and Charles and of course Edwin have said. All these kinds of supports, it would be so beautiful to have our workplaces recognizing from the leadership that they need to do something, put in place the right policies, make it safe for people to disclose when they have a mental health condition, and get them the support, and even give their managers the support they need to recognize when their staff have an issue and what to do about it. But of course, signposting to care, and we know employers can also push for mental health conditions to be covered in insurance, so that people are not hiding and not disclosing their mental health conditions. So thank you, Sue. I think this is the time to work on mental health in Kenya.
Fantastic news. And I think, Rosemary, I'm just going to take 30 seconds with you now, and then I'm going to ask you all one quick piece of advice, because I'm waiting, by the way, for questions to come in. So if anybody's got any questions, please post them now. We've got probably 5 minutes for questions. But Rosemary, you're particularly interested in developing a workplace mental health and wellbeing package that you want to pilot in the next 9 to 12 months. So if anybody wants to make contact with you, I think that's going to be an amazing initiative. So taking your mental health and your anti-stigma expertise and community mental health expertise is now looking to the workplace as a key setting for this work, which we want to wish you all the best with that and all the success. And it sounds like it's a very good time to launch an initiative like that. Questions come in. So actually we're going to take questions. And then I'm going to give each of you a 30-second pitch, the one thing you want people to take away. What's the one thing you would like people to take action on stigma? So one bit of advice or one plea. So there's a question that's come in, and the question is, how do you support people to share their stories and protect themselves when doing so? So we've talked a few times about the kind of assessment of risk to your situation if you are going to disclose your mental health problem. So how do you support people to do that, and how do you keep people safe doing that? So I'm actually going to ask Jasmine that first, like you and your fellow ambassadors, and then Rosemary, if you could just briefly say, how do you prepare and support people to share their lived experience? I think just very brief responses from you both, if that's okay.
Sure. I think the quick answer for me is you have to find someone with the right bandwidth. It's not like everyone can get on a call and talk to strangers and say, oh, this is my personal situation, right? So I think find the right person to talk to.
Thank you. So the right person in terms of like, you find some...
I think right? In the office, like some of your friends, some of also your friends, right? And I think, find the like-minded people, I mean, in particular. Mm-hmm. If you know someone who has been through certain situations as yourself, that sort of person will likely have to share similar bandwidth as yourself. So that would be the go-to person, in my view.
Thank you. That's right. So choose who you might open up to first, and actually, as you grow with confidence and you're reassured that it's safe, maybe then go to colder audiences. That's a very good suggestion. Thank you, Jasmine. And Rosemary, what would your response to that be? Because I know that you do a lot of work preparing your champions and supporting them.
Yes, part of the support to provide for the champions is training, and they get training again developed together with Time to Change Global. They get trained on levels of disclosure. What are you safe to disclose that you do not mind hearing it again, because once it's out there, it's out. So what are you safe disclosing? Why are you disclosing this? So to be purposeful in how they speak about their own experience, and also to provide a safe word for them. So for example, they could be in a conversation and it becomes uncomfortable for them. They can do something or say something so somebody can come and step in and end that conversation for them. So those are some of the steps, but mostly the training that covers that's part of the training that we provide for them.
That's brilliant. Thank you, Rosemary. And at Time to Change, the England programme and the global programme, we had a huge amount of training for champions considering sharing their stories, but then it's really important that there's ongoing support, isn't there? Because actually you don't know which person's going to react which way, and actually at times you might decide to step back from that or reduce how much you share of your lived experience. But to know that there's support there in your workplace, either from other ambassadors or from somebody managing the mental health programme, is really, really vital. Because as we started off this conversation, it's not safe in every single environment. As that the millennial survey said, a lot of people still don't feel comfortable at work talking about, or safe talking about their mental health to their colleagues, their managers, or to leaders. So we've got a lot more work to do. Thank you both very much for that. So there's lots of tools and examples. There's also a Time to Change Global toolkit on the web. If anybody wants to see that, that takes you through the Time to Change methodology and shares some of the work of champions around the world, but particularly in Africa and Asia in that programme, in India and 4 African countries, how champions were prepared and trained and supported. So lots of tools and advice out there as well. So I'm just going to end because I don't think, or let me just check, I don't think we have any more questions. So we've got off lightly. No more further questions. So we've got time, just 30 seconds from each of you. What's the one thing you would say to people that might be thinking of running a program or that are running a program as employers? What's the one thing you would say they should focus on to start with to take action on the stigma of mental health in workplaces? So I'm going to go to Charles, Jasmine, Edwin and Rosemary, please.
I mean, that is so difficult because there's so much to say on this. And I will repeat, maybe just to reinforce a bit of what I was saying earlier on. I think be honest about the fact that we don't have all of the answers around this. This is a big topic, it's complex and it differs in different countries. So engage your people, you know, get a group of employees together, ask them, make them part of the solution.
Oh, brilliant. Thank you. I'm just writing that down, Charles. So Jasmine, please don't say the same thing. You don't have all the answers.
I think for me, I think I would more sort of from the receiver point of view, right? The resources are there from the company, and it is actually up to us to actually take care of ourselves, to make use of the resources that's available from our companies to actually, you know, to look after ourselves. And I always insist to say, you know, the cliche is be the best version of yourself, because, you know, that would mean you would work better, you know, you would actually be more a better partner, you know, to your better half. And then it's something which is important, that we have to look after our mental well-being so that we can be the best version of ourselves.
Thank you, Jasmine. Thank you very much. And thank you for that. Edwin, I'm coming to you for a brief response, please.
Yes, 3 ships. Yeah. First of all, leadership. Secondly, mentorship. And thirdly, ownership. We spoke a lot about leadership. Mentorship is really about bringing competence level up, helping people to get there. And ownership, we spoke about that as well. So it's not the silver bullet, but it's going to help. Thanks.
3 ships, that's brilliant. Thank you very much. I've never heard that before. I love it. Thank you very much, Edwin. That's brilliant. And Rosemary, what's your gem of knowledge and advice to employers either on their way or thinking about doing more on stigma?
Thank you, Sue. I think I'd say what everybody else has said. Yeah, I would say, yeah, let employers should be very deliberate about it, to think through what they need to put in place to make that place safe for people to disclose their mental health condition and to get the support they need, but also to put in place a program so that it's not a once-off thing, that they do it this time and then the topic comes up again, World Mental Health Day, and we do this little thing, and then it's Suicide Prevention Month, and then we do this little thing, to have in place something that lasts and that people know how to interact with at different times when they're feeling low, or even just to improve their well-being generally. Thank you.
Brilliant. So sustained effort, sustained and focused effort, not just, oh, it's World Mental Health Day. Oh, it's yes, absolutely. Because this is the work of a generation, we said on stigma. And when we started Time to Change in England, that was 15 years ago. This needs long-term commitment. You can't overturn generations of stigma and discrimination with one campaign. Thank you. Now, I think without any more questions, I think there's just a chance for me to thank everybody. While everybody that's on this session, please do answer. There's going to be a poll. So rather than an evaluation questionnaire, there's going to be a poll that we're going to ask you to answer towards the end of this session, which is going to come on. It's called a glitter poll, which makes it sound very exciting and disco-like to me, but I think that's just the name of the company. But I would really just first and foremost like to thank all of our panelists, Jasmine, Charles, Edwin and Rosemary, for being so open and generous with your time and your advice and your guidance. And thank you for everything you're doing to address mental health stigma and improve workplace mental health and wellbeing. It's been fantastic to have the opportunity to spend time with you. And I'm sure you've inspired a lot of people even to take action. And obviously, I'd like to thank the GBC as well and MindForward Alliance. Don't forget that the leadership pledge with the GBC has been signed by 100 organisations over 62 countries across 6 continents. I think I'm right in saying that. So if you haven't made your leadership pledge and your commitment, you've heard how important that one of the 3 ships is, Edwin, to steal your line, please do get involved. And as Charles said, you know, it starts with a commitment in the leadership pledge. It ends with evaluation of the impact of that pledge and your action. And in between, there's a good chunk of very practical, sensible ways to take action. So do think about that and make your pledge. It's up to us to make the difference happen. So we hope that we'll see something come from this session. We would love you to undertake the poll and tell us more about what you thought of this session and what we might do differently next time. We're all on our learning journey. And I think that's it, apart from thanking you for joining us. And I think this session, yes, it has been recorded. So if you want to watch it again, or you want to share it with colleagues and you're a member of the GBC, or involved with MindForward Alliance, I think it's going to be on the GBC website. So apart from that, it's to wish you well and thank you for joining, and thank you so much everybody on the panel for being part of this discussion today.